We're excited to share some insights from Dr. Chang, a pioneer in the world of minimal stimulation IVF. Minimal stimulation IVF is a patient-centered, gentler approach to fertility treatment that uses a lower dose of hormones to stimulate the ovaries, aiming for fewer but higher quality eggs, resulting in healthier embryos and improved success rates.
Mini IVF, it's a little confusing, but most people refer to a protocol where it's oral medication called Clomid with injections. What is the purpose of the oral medicine, the Clomid? It stimulates your natural FSH production in your pituitary. By doing that, you can reduce the amount of injections that are needed, which cuts down a lot on the cost. The other thing about a minimal stimulation protocol is the focus on not trying to create so many eggs. Instead of trying to get 20 or 30 eggs, the idea is let's try to get half a dozen of the highest quality eggs. Some of the data from the Cottage Ladies Clinic suggested that eggs are not random events, that it's not, hey, look, this egg might be good or bad, but as the eggs develop, there is a hierarchy. There are good eggs that grow faster, bad eggs grow slower. In a natural cycle, even though there are 20 or 30 follicles at the very beginning, there's usually one follicle that actually grows to full maturity and actually ovulates. And typically, some of the data suggests that that is your best quality egg in the cycle. It may not always be your best quality egg, but that is one of your better quality eggs. So by stimulating, what you're stimulating is first best egg, second best egg, third best egg, and that's the fundamental premise behind minimal stimulation. You're focusing on more quality than quantity. With fewer eggs, you can also do these egg retrievals under local anesthesia. You don't have to be asleep. It's not the most pleasant experience. It's kind of like going to a dentist for a cavity getting filled. I've actually had patients have no anesthesia for these local egg retrievals. When I was in New York, they would jump off the table, run to the subway to get right back to work. Here in Southern California, most people take the day off. There are many women who they don't do well with medicines, or they're very afraid of injections. They just don't want to have the side effects associated, or they want to even keep the cost down. And this is where minimal stimulation, even though the success rates might be lower for someone under 35, those patients may still be, they may want to be open to that type of protocol. Now, as we get older, what we find is a lot of the studies have shown that as we get older, the stimulation doesn't make much of a difference. That at that point, minimal stimulation becomes equal, and at some point may even be superior to traditional IVF. With traditional IVF, a lot of it is sacrificing that dominant follicle. One place where it doesn't matter really how old you are, but where I find that minimal stimulation works much better than high stimulation is in cases of diminished ovarian reserve, premature ovarian insufficiency, because the FSH is already so high to begin with. The problem with a traditional high stimulation cycle, you overstimulate. The FSH gets very high, shuts down the follicle development. In a diminished ovarian patient with these lower protocols, you're less likely to overstimulate those eggs, and you'll let the eggs grow unencumbered in those cases. So with mini IVF, it's not better in all situations. Like I said, under the age of 35, overall success, yes, the high stimulation protocol is going to give you a higher success, but at what cost? Financial cost, physical cost, emotional cost.
Every patient is different, and speaking with a fertility physician can bring you a lot of answers custom to you. Reach out to Hanabusa IVF today to speak with one of our experienced doctors and find out which type of stimulation protocol is best for you. Reach out to us at www.hanabusaivf.com today.